Hi, everybody. If you don't know me already, I'm Janina. I am a program manager here at the Association of Maternal and Child Health Programs. We call ourselves AMCHIP. This is the Pathways to Sustainability webinar series that we've been running for the past couple of weeks. And also we had it in November as well. Today, we have two presentations every time we meet for our webinar. Today, we will be hearing from SisterWeb, which is based in San Francisco, California, where I'm also based in, which is lovely. And then also Black Women's Blueprint across the nation in Brooklyn, New York. Today, we will hear a bit about the state of development and fundraising from a community-based organization perspective, as well as co-designing initiatives with and for families from these leaders. And we're going to start with SisterWeb's presentation, transition into Savannah's presentation, and then hold a joint Q&A at the very end, as we have been doing for the webinars. But if you're new, please put your questions in the chat or the Q&A, and we'll get to it at the very end of the webinar. So it is my delight to introduce you to Ali Cuento. She's Director of Evaluations at SisterWeb. She is a mama, a daughter, sister, partner, creative, and birth and full spectrum doula. She's a founding member of Community Well, a holistic family support center in the Excelsior neighborhood of San Francisco. Along with Marna, she is a co-founder of SisterWeb and currently serves as the Director of Evaluations, aka the Data Queen. Ali has supported 500 births, mentored dozens of new doulas, and taught hundreds of expectant families in childbirth education classes. Prior to her finding her calling as a birth worker, Ali designed curriculum, coordinated early education programs serving immigrant families, as well as taught in public schools and preschool settings. And Ali is joined by Sophia, so I will take a minute to introduce her as well. Sophia Lara Carbone is the communications coordinator. She is a queer Argentinian vegan auntie and sister. She has a master's in public health degree from Brown University, where she focused her studies on global health, sexual and reproductive health, and community engagement and outreach. She has worked as a case manager, sex educator, and abortion researcher in women-led institutions and teams across the world and owns a sustainable fashion business. Sophia is the communications coordinator at SisterWeb, where she spends her time writing and designing newsletters, social media content, research infographics, and so much more. She is also the preceptor for 2 Masters of Public Health candidates. Sophia joined SisterWeb to bring people together, develop creative communication strategies, and expand awareness of birth equity and reproductive justice. So now I will turn it over to these two to tell us about SisterWeb and their sustainability.
All right. How's everybody doing? I'm like expecting the webinar to respond back. You can put it in the chat if you want. I give thanks for these digital platforms to connect with people across the country. It's wonderful to be sharing space with you, Savannah. I come from a lineage of Brooklynites, so I call in my grandma, who was Bensonhurst, one of the ladies with the rollers sitting in a folding chair and hustling in Brooklyn. So it's nice to be with you all. Sophia and I are going to be presenting on our sustainability grant. We give thanks to AMCHIP for creating these spaces for peer learning. And Sophia, if you want to do next slide. On here on the right, you can see a photo from our event that we're here to present about. The event was called SisterWeb Shines. You're going to see more photos later, but this is the staff of SisterWeb. This is our team. We really give thanks to all of our coworkers, and Sophia and I are humbly repping our organization today. I'm actually standing in for Marna Armstead, who is supposed to be presenting today, but is out on a medical leave. So if you want to just say a prayer and send good vibes towards Marna, we all appreciate it. Next slide. And Sophia, do you want to share a little bit about SisterWeb? Oh, you're on mute.
Thank you. So SisterWeb San Francisco Community Doula Network was a vision created by birth workers from and for the communities they support. Our mission is for doulas and birth workers from and for Black communities to dismantle racist healthcare systems, strengthen community resilience, and advance economic justice for birthing families and doulas in San Francisco. We've supported 482 families since 2018, and we currently have 10 staff members.
And I want to just call attention to this beautiful photo. It's possible there are many others from organizations out there that we found ourselves like years into the work with almost no photos of what we were doing. Birth is a very sacred space. We hold our clients' privacy very seriously. And so we were blessed this year to work with a wonderful birth worker who's also a photographer and identifies as a Black woman, who was able to work with some of our client families and our doulas to capture the moments and really shed light on the work that our doulas and doula apprentices, here we have doula Jaya working with apprentice Bree, supporting a really joyful birth. This was only a couple months ago. Next slide. So here, we just wanted to highlight the sustainability domains, and we're going to move to the next slide and just share briefly some highs and lows and lessons learned through our sustainability grant. So in a nutshell, we used our sustainability grant to really host our first ever community share back. It was a beautiful event that was held in the southeast of San Francisco, right in the same neighborhood where the SisterWeb office is. It's a historically Black neighborhood where about a third of our staff and clients reside. So some of the I'm going to just start with the challenges, you know, the rose, thorn, and bud. I'm going to start with the thorns and then end on all of the amazing successes that we had. So some of the challenges, we have really struggled over the years with some of the administrative capacity of our organization to develop and maintain donors, individual donors. I feel like a lot of grassroots organizations, we really hit the ground with a hyper focus on centering the work we were doing, right? Showing up for births, training doulas, supporting our families and staff in all the ways that we needed. And we never had designated staff capacity to focus on development. So that's, you know, goes for both grant writing, but especially with the individual donor fundraising. So some people say, oh, you're located in San Francisco, one of the, you know, most resource wealthy cities in the world. And yet we just hadn't found ways to tap into the potential of individual donors. And as funding priorities in philanthropy change, our city budget for public funds is undergoing a lot of shifts right now. We were really realizing our need to diversify our funding to be able to keep our doors open. So just that capacity to maintain the donor database was a challenge that we were facing. I think we definitely made some progress along the way. Some of the other challenges we faced, we held our event at the end of the year and, you know, competing with a lot of other events in December, along with some bad weather that day, our attendance was a little bit lower than expected. So that was, you know, one of the things that we struggled with. And then I think, you know, one of the other things that we realized is a lot of people who came described our event almost like a family reunion. It was beautiful. We had, this is one of the highlights, was we had amazing representation from staff, former staff, clients, former clients, a lot of healthcare providers who our doulas have worked side by side alongside of in the community for years. We were able to present community awards to some of our most beloved supporters and advisors. I see in the participants, there's somebody here from Alameda County, just across the bay. Hey, hey. And we were able to present an award to one of our longtime allies and SisterWeb advisory committee members, Dafina Melbourne. So there was just so much love and support and solidarity at our event. We did not achieve our full fundraising goal. So we got close, but we didn't quite get there, and really realized that, again, tapping into those stakeholder groups that are going to be the larger donors, we're still trying to crack that nut and figure out how to do that. So I think the one other thing that I'll share, and then I'll pass it on to Sophia, was just around the mobilization of our staff and interns and volunteers. There's nothing like a party to bring people together. And this was our first ever. And so I think our staff were just really excited. Everyone showed up looking amazing, bringing their families and loved ones. And then we did have an amazing crew of interns from different Masters in Public Health programs that are working with us, as well as other volunteers who showed up supporting in so many ways. And so the event logistics went beautifully, really smoothly. A huge shout out to Sophia, who really did a wonderful job co-coordinating it. And you can go to the next slide, Sophia, and I'll pass it to you.
Thank you, Ali. So there's many reasons why people donate to SisterWeb, and the reasons they donated, especially at our recent fundraiser, which I'll talk more about later, and which Ali just covered so beautifully. So a former doula trainee that was at the event described that she was trained by SisterWeb, and the opportunity for her to donate was a way to pay it forward and really feel like part of the SisterWeb family. Family is a word that we always use at SisterWeb, not just because of the work we do, but because it's definitely a shared sentiment between all of the staff or family members of SisterWeb. She also used the phrase "from her culture, in unity there is strength" to describe what the power of coming together for shared goals can have. Reflecting on this perspective, the short-term goals for the grant are to improve our strategies to reach donors. The intermediate goals are to solve our current financial needs and gain more visibility. That's a huge part of communications right now. And the long-term goal is to diversify our funding streams and increase our skills in event planning and also carrying out events. So now I'm going to talk a little bit more about the SisterWeb Shines event that we were able to carry out. It looks like there was just one photo that didn't show up in the slide, but this is just a very brief overview of, some of the sites that we had. I love this photo showing literally the big picture of the event here on the upper left side. You can see some of our community award winners, and then you can also see a very cute photo of one of the family members that was at the event as well. And then lastly, we have here Deandra, who was the director of workforce development, just sharing some information about her program. So the SisterWeb Shines event took place on December 1st, 2023, like Ali mentioned, and the purpose was truly to raise our funding goals and spread awareness about SisterWeb, including our efforts to dismantle racism in healthcare through the Champion Diet Initiative, our training and mentorship program for community doulas, and our Kindred Birth Companions and Semilla Sagrada programs. We had different stations with audio and visual materials and data sheets, as well as staff members at each of these stations sharing more about these specific programs for all of those who stopped by. In addition to online donations that people were able to make through the different QR codes that we had all around the space, we collected funds by selling onesies and t-shirts that were donated to us so that people could purchase one for themselves or a loved one, or purchase one and donate it back to SisterWeb. Our event programming also included a review of our mission and vision by Marna, our current sustainability needs, a poem by local artist and also Marna's daughter, Aliyah, and a drumming performance by a local father-son group called Bateria Batucci. We also showed appreciation for our event sponsors, and we held an award ceremony for community members who advocate for SisterWeb and who support SisterWeb in different areas, which are aligned with our organizational goals. And in true SisterWeb fashion, like Ali mentioned, this really felt like a family reunion, and we had a diversity of attendance from donors to community members, families, friends, and partners, and also partners organizations. All right, here's that other photo.
Okay, so yeah, just sharing quickly about what's next, and this is kind of our wrap up, is thinking about this word sustainability as an organization that really has two different sets of stakeholders, our clients, pregnant Black families here in San Francisco, and also our doulas, really cultivating that workforce. We have realized that it is so important to really understand better the funding landscape, to be able to cultivate those larger donors, and the individual donors filling the gap in general operating funds, which I'm sure I'm preaching to the choir. Anybody who runs programming knows that those unrestricted funds are just so key to keeping the glue of the organization together, and a lot of the harder to fund positions that our doulas depend on for support. And then really, looking at other external factors, like I mentioned, our city budget, which has been impacted by budget cuts, and trying to swim upstream against the pattern of CBOs, community-based organizations, especially Black-led, women-led organizations, having to vie for dwindling fundings and creating competition between programs. We are just actively trying to fight against that at every moment, collaborating with other programs and even uplifting other programs' works like we did with our community awards. So factors that would accelerate our success, these are what we are speaking out to the universe that we're hoping to be able to do in the coming years, to keep our program running long term, is to be able to hire a staff person dedicated to fundraising and development, something that we have never had so far. Really being able to identify funding sources for those general ops dollars that are unrestricted and allow SisterWeb to run the programs that we need to run. And then branching out, like I said, in the Bay Area, there are a lot of tech companies. There's a lot of, other opportunities for corporate sponsorship. Again, sort of like a bucket that we have not explored up until now, and increased involvement from our fiscal sponsor. We are a fiscally sponsored project, and our fiscal sponsor, Haluna Health, really came through with additional support for this event, and I think was a springboard to working much more collaboratively to identify other funding streams. And so if you want to go to our last slide. Thank you. We appreciate you all. We really are hoping to, continue learning from other programs, especially when it comes to fundraising, development, and sustainability. And just really, again, want to give thanks for AmChip, not only for the grant, but for the ongoing technical assistance, support, partnership, and love that we feel from you all every day. So thank you so much.
Thanks so much, Ali and Sophia, for your presentation. I am excited to introduce our next speaker. One second. And if you all have questions about Ali's and Sophia's presentation, feel free to send your questions into the chat. Okay, so next up, we are featuring Savannah Brown. Savannah Brown is from Black Women's Blueprint and serves as the National Director. She leads the Safer Childbirth Cities Initiative through Merck for Mothers Maternal and Child Health Portfolio. She provides oversight to the center, which provides health, healing, and mobile health services and racial equity to Black women nationally. Brown is a doula and has been featured in the documentary The Business of Birth Control, directed by Ricky Lake and Abby Epstein, as well as Aftershock, directed by Tanya Lewis Lee and Paula Iselt. Brown is also a recipient of the Mellon Mays Fellowship for Research on Black Maternal Health. She has experience leading girls' initiatives focused on violence intervention and reproductive health. Brown has experience in clinical experiences in postpartum support, home visiting, prenatal care, and childbirth education for pregnant women. She has worked in integrative health medical offices, nutrition programs, and leads initiatives like mobile health vans. Her expertise spans across continuity of care, home birth, birth centers, and maternal fetal medicine. She sits on the Respectful Maternal Care Council organized by White Ribbon Alliance, and she currently sits on the New York City's Maternal Mortality and Morbidity Review Committee. She has trained midwives and doulas at colleges and universities, schools of nursing, and within birth center settings on platforms such as CVS, Minute Clinics, and insurance companies such as Aetna. She has expertise and drive to serve as multiple principal investigator for the proposed community and academic partnership titled NY Champ, and look forward to working together along with NIH's Maternal Health Research Centers of Excellence in providing the best obstetrical care possible in the state of New York. So with that being said, I will pass it over to Savannah.
Thank you so much. And I just want to say thanks to the SisterWeb team for your amazing work. I've always heard about your work and seen you in these spaces in our community of practice, but I'm just so inspired by you. So thank you so much for your sisterhood and siblinghood in this work collectively. So I'm going to share my screen and I will look to the folks out there to let me know if you can see my screen while I'm sharing. So you can give me a thumbs up or a nod. I see Ali nodding. Is it showing you a full slideshow share now, or is it only giving you a loading page or something to that effect?
We're getting the loading page.
Again, okay, let me try that one more time. I think last time I had to share my whole desktop and I think that worked. Okay, exit full screen. And now can you let me know if it's showing you the slideshow? Okay, I see a thumbs up. Thank you so much. Grateful for the Brooklyn love. Yes, this is the Brooklyn Safer Childbirth City, co-design and design for equity in Brooklyn is our project. I'm actually not a Brooklynite. I'm from Michigan and I'm currently in Michigan, and I extend love and acknowledgement to my African Indigenous ancestors who traversed these lands en route to freedom, and also my Native American and Indigenous siblings who are the original stewards of this land. But all of my work is situated in Brooklyn, so I'm really grateful to represent the Brooklyn neighborhoods and the pregnant and birthing people of Brooklyn. So our team, I really wanted to start from a wide scope around who our team is. Our Safer Childbirth Cities initiative named ourselves the Anarcha Collective to really pay homage ancestrally to Anarcha, Betsy, and Lucy, who stories are survived by archaeologists and anthropologists and Black women, Black feminist scholars who really talk about and discuss the harms and violations that Black women and birthing people have faced at the hands of colonization, enslavement in the United States. And part of our work in underpinning our work in the Safer Childbirth Cities initiative has been centralized in ancestral rememory and also reclaiming that which was stolen from us as peoples of African descent. So a lot of our work and our strategies and our technologies that we implement, much like SisterWeb, is to really harken back to those traditions and also to undo the injustices that we see as we're impacted by maternal mortality and morbidity at severe rates in New York City. So many of our partners are around this circle, and one of the partners that is not around this circle, but that is truly incredible and remarkable and has been just really, really profound in our capacity building is the AmChip team. So want to thank you and acknowledge you here publicly and share that we see you as a part of our family and our team. Black Women's Blueprint is a sanctuary for the protection of Black women's sovereignty and dignity. And our work right now at our center is around empowering Black women, girls, and gender fluid people. And we're really looking at human rights in order to secure gender and racial justice through the eradication of sexual violence and also through access to full spectrum reproductive health services. So you'll see our membership here in Brooklyn in the lower left. and myself and my co-director, Farah Tanis, with the Brooklyn Community Foundation leadership. So that's a glimpse at the folks who make up our community team and space. These are our young people on our stoop in Brooklyn doing flower crowns. But we have about a staff of 10, and our work is situated in culturally informed healing services and healing interventions that include art therapy, drumming, healing circles, healing food, and food with healing properties. Our work has been, since its founding in 2008, survivor centered. So while we engage pregnant and postpartum people and folks across the perinatal arc, we are centering survivors of gender-based violence specifically. Again, we were founded in 2008, and our work has really expanded and grown to really build partnerships across mental health and obstetric providers to be responsive to racial inequity that we see, not just in Brooklyn, but also in our statewide work. And our Safer Childbirth Cities project is steeped in designing for equity and coalition building. We were really strategically thinking about 3 years ago about how to build an initiative that prioritizes the safety of pregnant, birthing, and postpartum folks, defending the human rights of women and girls, ensuring bodily autonomy, and of course, importantly, securing access to high quality primary maternity care in communities that were most impacted by the overlapping maternal health crisis, maternal mortality and morbidity, and the COVID pandemic through our co-design and design for equity approaches. So we were really looking to commit to 2 overarching goals, which was to define, design, and test an ongoing process for strengthening primary maternity care. And we wanted to do that by integrating community-generated learning, co-design, and evidence-based models. And then we were hoping to, and I think that we're actually in a good position now to do so, integrate and disseminate lessons learned and advocate for structural changes. The second component of it, which is around integrating and disseminating lessons learned, is actually really focused and situated on what our sustainability project it was, which I will get at in just a moment. But we were focusing on evaluation, monitoring, and learning as our sustainability approach. A little bit more about our project. You can read more about it online, but I would say the last paragraph is most important just to understand, to not reiterate things that I've already said. But we wanted these interventions to be holistic. We wanted them to bring high value care. We wanted them to embody community-centered design and improve physical, social, and emotional well-being of folks across the perinatal spectrum. And we wanted it to not only impact Brooklyn, but also be a replicable model across New York, which is why evaluation and monitoring felt very important to our sustainability project. So the rationale for the approach for why we took on co-design and designing for equity was to focus on the communities with the highest, most severe maternal morbidity and highest rates of complications, which for us were Black, Indigenous, people of color, and their families. There was also a need for community-based solutions, and improved outcomes in this area proved very extreme. And that we found that the community itself is where the wealth of insight, expertise, and knowledge was situated, and that was essential to designing a more equitable primary care model. So for our sustainability project, as I mentioned, we were really invested and interested in how to approach qualitative and quantitative learning monitoring activities. So our project is addressing sustainability concerns through rigorous community-led, co-designed perinatal health listening sessions, qualitative, quantitative learning and monitoring and evaluation activities, which we saw as combined. And we were focused on a couple of other things that we knew kind of fell into those domains of sustainability that Ali talked about, which were increased staffing, right, capacity, increased opportunities for community participation, which meant how do we innovate the program design and program model, and then increased access to learning and co-design skills and curricula. So our plans to sustain the project when we applied for the mini grant were really clear. We wanted to engage in evaluation activities that were centered on bringing in an external evaluator to not only support with tracking the quantitative service delivery, but also the story arc of how this work is actually getting done. The people who are mobilizing the work are the people who are impacted by the issues as well. So there was kind of this meta analysis that we needed to be done. And so with the grant funds explicitly, we secured Philibert Research Firm to evaluate our design for equity process and its outcomes. So that meant internal storytelling of our actual team and the coalition itself through interviews and focus groups and storytelling and a number of other activities that we engaged in. And then also interfacing with the community at large. So our evaluation team employed and continues to employ a real-time process documentation to support its monitoring and evaluation. We also used a system called PowerBase for outcome evaluation, and we really measured through quantitative and qualitative indicators. So we wanted both the number of individuals served and the qualitative impact on their lives, the number of individuals who committed to the project, and the qualitative impact on our lives as well. Like, we got to talk about how we were changed by the work that we delivered. So we implemented blueprints. We worked on fostering trust and accountability a lot. So we actually designed the metric that we wanted to be studied. So we wanted to actually talk about what the quality of the human experience was, what the arc of trauma, healing, and transformation was, and how trust was also fostered in coalition. We actively involved community members in every stage of the process to increase community ownership, collective responsibility, and also to boost the initiative's relevance and sustainability. We didn't want people to come in for focus groups and interviews who weren't a part of the neighborhoods, who weren't a part of the communities, who we didn't have a way to on-ramp them into long-term project initiatives and project leadership. So we ensured that we could do all of that. Some of the ways that we approach that, and I'll show you a couple of the flyers and the events that we did, were through open dialogues. Of course, we did focus groups, but we made it fun. So you came out and ate with us, danced with us, enjoyed feedback spaces where parents and families were welcome through giveaways and through our mobile unit. And then, of course, we also used surveys to capture information from folks who we didn't have real-time contact with, who weren't able to make it to the events, or their perinatal period just did not allow them to be out safely with us or to join us in collective communal space. So we wanted to stay inside of our Brooklyn, habits. So when we advertised this work to our community, and below you'll see the 6 coalitions who mobilized this work with alongside Black Women's Blueprint, which is Ancient Song Doula Services, Devi Women's Health, Elephant Circle, City Block, and Primary Maternity Care. So we're a coalition of 6 altogether. We really wanted to make sure that people knew that this was going to be a series of neighborhood events, that this was going to be workshop design based, that we were centering pregnant and parenting people. We also had space for healers and advocates to come together and birth justice champions. And then we also had separate spaces for healthcare practitioners. We wanted to also disrupt the predominant narrative of maternal mortality and morbidity and really lean people towards the future. So we started using the language of towards perinatal vitality. And we actually did some evaluation around whether or not that resonated with people to see if that future forward intervention was timely or if it was premature. And also to do some testing around what people needed in order to see a future around vitality in Brooklyn and for birthing people. So we ended up gathering about 300 folks to come in. And what we did was we integrated our evaluators in the space. So every aspect of the process was a part of the evaluation, but we also required our evaluators to sit on the other side of evaluation and also share their perinatal stories. So for us, it was really about decolonizing research, decolonizing data, and really thinking about how co-design is the collective design of a community, and that no person gets to wear one hat at a time, but really is seen as a part of a community and in accountability with that community. So the two flyers that you see here, the one I'm talking about, the two that are stacked on top of each other. The one was a 3-hour workshop that was broken into 2 segments. Doulas and birth workers came together, and however you identified was fine. Some people might have identified as birthing people as well. And then advocates came into another space, and it was okay if you came to both. And then the one below was actually for hospital-based practitioners. So CNMs, LMs, OBs, nurses, pediatricians, et cetera, came to the other workshop. And some of the things that we did in those spaces were we had people design maps where sites of harm and crises had happened in Brooklyn, and many of them were hospitals, hospital rooms, clinics, some public spaces where there were intersections of police brutality and family safety. We really thought about perinatal vitality as a broad spectrum definition, and then we honed in on more specifics of sites where perinatal care occurs. And then we had people map the future spaces in Brooklyn that they wanted to see. So that was a part of our assessment, was also generating these visual experiences from community members. As you can imagine, a lot of grief was processed in those spaces. So we had kind of intergenerational healing spaces, families and communities present with one another. And we also had clinicians on site to support folks through processing. So we invited impacted persons to join us to design perinatal vitality in Brooklyn. We gathered stakeholders across the perinatal ecosystem so that we could think about how to prioritize center and care for pregnant and parenting people in the future. And there was a specific focus on Black birthing people in Brooklyn for most of the sessions. So in the pregnant and parenting space, we actually were able to stipend, as a result of the grant, folks to participate. And at some point you forget it's an evaluation event because it's also a community event. It's a space of dreaming and co-design, gathering, collecting information. And our evaluators were actually able to bridge a gap between what the community was dreaming perinatal space and ecosystem should look like and what we were dreaming as a coalition and collective, and where there was actually a lot of bridge and overlap because, again, the coalition was made up of community stakeholders, right? So that was the series of evaluation activities predominantly that supported pregnant and parenting folks. One thing I will say in our self-evaluation was that we wish we had had more of this space. While we loved gathering the doulas and gathering the midwives and the hospital administrators, and there was overlap between pregnant and parenting people who came into those spaces, we wish we had been able to spend more time with pregnant and parenting folks or give more than 2 options, just because we know the barriers to accessing space for a lot of pregnant and postpartum and parenting people, right? So transportation, of course, we had childcare available and we did Metro cards and stipends, but it still requires you to actually be able to have the bandwidth and to have a cradle and community of care to like get where you're going, right? So creating more options or even virtual and digital options would have been great. We were able to document the spaces. So we have photography, video, and audio and transcription from each of these spaces. And we're really grateful that we were able to include that and are implementing that in our final report. Some of the challenges that we faced in sustainability programming, of course, include the public health emergencies and crises. It's been really hard to just be with our people, how we're used to. I will also say number 2 in sustainability challenges in the state of New York is the Medicaid landscape and the midwifery licensure landscape, very similar to what SisterWeb described in the backdrop of philanthropy's ever shifting kind of funding priorities, where like birth justice is hot some days and some days it's not, just to be completely honest. When it comes to government sources around perinatal health and birthing people, we often are facing those same realities actually there, or there are limitations to how creative we can be in bringing and delivering services to folks. So sustainability challenges were presented in those ways. And we really wanted to center evaluation and monitoring because we wanted to say, we actually need to demonstrate that these interventions work. It actually does work when you go and feed someone and you sit with a pregnant person and you stipend them and you gather their wisdom about what the labor and delivery space should look like and be like, right? Um, so it felt really, really important to say these culturally sound, ancestrally known ways of being are evidence-based as well. So I wanted to also name that that was really why we took the angle of evaluation and monitoring as a sustainability approach, not just to track and prove that the work was done, but to say that the way we did the work actually leads us closer to the perinatal vitality that the community is calling for. So I think I've gone over this enough. I won't talk more about like why we did the project that we did and how we implemented it. I think that that's been very clear. Um, I will share this. This is a component of our zine that's going to come out, which has some of the findings of this evaluation and monitoring that we've done. And we really leaned on the theme of mapping a lot because we did mapping as a primary way of engaging the community. So our in-person co-design space was one that I just kind of walked you all through how we did that. And there's some elements of who was involved and how they were involved. We also held a birth justice cipher, which was a virtual space, but it was primarily folks from the perinatal workforce, not necessarily on the constituent side who were part of the cipher. And then we also did an in-person mapping in justice and hope in birth work in person. And we were able to engage a block party, bring a mobile van. We really use the strategies of the community for the community and by the community in this space. So the blue bubbles are our co-designers. The green bubbles are the tools that kind of emerged from that space. The purple bubbles are the people and partners, so the capacity that went into it. And then the yellow bubbles are clearly the 3 events that I articulated to you all. These 2 down here are the ones that were able to be executed during the sustainability grant period, the co-design space, the 2 in-person spaces. We were finally able to be together, even though we had to find a lot of creative ways to still stay healthy and safe. The blueprints that we focused on, and just mindful of time, I'll probably go really quickly through the next couple slides so that I can wrap here. We focus on 3 interlocking blueprints, which were design, regulatory payment system, and care. And these were some of the outcomes, not all. The tools we created, the organizations we impacted, the hospitals we impacted, the doulas that we trained, the midwives we engaged, the health teams that we trained, and the legal support that we also trained. So really proud of that impact. This is just more about how we navigated the qualitative and quantitative differences in learning, evaluation, and monitoring, and measuring success. We actually ended up bringing in a second evaluator who was focused primarily on storytelling through the communal lens. And I talk a little bit here about the funding landscape again, but I really think our siblings at SisterWeb covered the need for resource sustainability in this current landscape for all of our organizations. And I make the connection here between evaluation and monitoring and sustainability. What will we hope for the future? We will continue to implement those maps and work with pregnant and birthing people to really think about more community-based solutions. But the next step is really to actually bring the findings into those partner institutions and organizations that we work with and to see what can actually be implemented in terms of design. So we're actually going to be taking those maps and developing an archetype now to disseminate. Future goals around sustainability include long-term engagement with the community and populations that we worked with, really adapting to external factors, not just public health emergencies, but global events, policy changes, et cetera. Greater collaboration. The 6 of us did an amazing job, but we think that we can have greater impact with even more organizations and people partners who are impacted. And one last thing that we found that was really important in terms of our sustainability is just how much complex and vicarious trauma is impacting our teams. Sustainability in terms of well-being feels very critical to center in terms of mental health resources and practices for the teams who are delivering this work. Lastly, again, big love to everyone. You're welcome to reach out to Black Women's Blueprint, which is also held under Restore Forward, to ask questions about our collective, to ask questions about what we hope to do with the results and how we've been engaging pregnant and birthing folks and postpartum folks. And to just engage in learning exchange. I think even though we're very centralized in Brooklyn, we're really open to learning from our neighbors and from our community members across the nation. So grateful for the time and space and looking forward to our question segment.
Thank you so much, Savannah. I think that, that's really why we're holding these webinars so that we can learn from everybody across the nation what is working and actually share our learnings. And thank you for that beautiful presentation. The mapping is so gorgeous. I loved it so much.
Thank you.
I am going to go back to our SisterWeb colleagues and start with them for a few questions. So somebody had said, congratulations on holding your event. It's a great sign to be told your event had a family reunion feel. I call that a success. Do you plan on hosting this event again in a different month to avoid competing with other events to help, with the numbers? It sounded like you kept you kept the community in mind by providing community awards and recognition, but I guess there was some excitement around your event and wondering if you're going to do it again.
Well, throwing a party is a lot of work. I mean, there's a reason that we hadn't done one in 4 years because we've been very focused on doing the work. I think that I will say, I'm gonna like slow my answer down for a second, say we want to be really clear about where we're putting time and resources and exactly what the goal is. So I think that like seeing this presentation, Savannah, about what you all did and that type of community event, I'm like, I want to do that one. So I think, I don't know that we would want to do another big fundraiser like that. I think we really want to be clear about what our economic sustainability goals are and how to achieve them, and then what our staff and families and clients want and need to feel really seen, heard, nourished, celebrated, uplifted in their beautiful journeys. And so those things might be different in the future.
Yeah, definitely. Kind of tangential, I guess I'm wondering, what kinds of support would you need to help your organization tap into stakeholders for funding or address even the administrative capacity, like, or lack of capacity to cultivate and maintain donors?
Yeah, that is a great question. I mean, I think that being very open and transparent about the unlevel playing field that organizations come into the work with, just acknowledging Marna, even though she's not here, I'm feeling her right beside me as sis and co-founder, for her really being identified with our clients and having had the lived experience of being a Black single mom, raising her family in the southeast of the city, not coming into her role as executive director with all these connections to corporations and tech, and the way that other organizations sometimes bring in those pre-existing relationships that have all the generational historical privilege associated with them. So we're trying to just, be very open about speaking about these issues with funders, trying to look in, I would say, like really following the good, looking at who is funding the type of work that we do that goes very deep with fewer individuals. We have a really high touch model of care, and a lot of, funders that we've seen want like high numbers of people that you're working with. and they don't really care that you spent 89 hours sitting at the bedside, right? So we're really looking at developing those stronger relationships of partnerships. I mean, I want to say, you know, like AmChip, like other in the funding space that truly want to partner and understand what we're doing. And we're trying to get more intentional about going there. And I would also say just asking for help more, I think is something that we learned a lot doing this event, is that there's a lot we don't know and a lot of amazing, brilliant people out there in our community. We had a mom with a young child come forward and offer her services to help us with event planning. And she rocked it. And it was just like, oh, that right. We, you know, we can ask for help more. And people are just very excited to come forward. And, you know, we learned there were bartenders in our community and poets and people who were like, yeah, we'll show up and support.
I love that. I think tapping into that like grassroots nature of community-based organizations is so useful, but I think asking for help can be the hardest part to get there, right? But I think you also bring up a great point about you know, going deeply, working deeply with families, right? And that it's this quality over quantity. And I think measuring impact is looking different. And that's something that, you know, AmChip, we are trying to work on amplifying and raising awareness of in terms of like, what is community defined evidence, right? How do we know that practices are working based on what the community leaders, you know, everybody who's on this call is saying, right? Like Savannah is doing an amazing work as well. But it's like, you know, how do we turn to them and say, how are you collecting evidence? How are you showing that this is successful and making an impact rather than just being like, we want to see you like, you know, be with 500 families in this year, you know, like I think that that's not like quantitatively, it's very important to look at numbers, but I think it's not as indicative of the impact. Savannah, a question for you. Can you share some of the overlaps or differences that arose between the different role designated sessions? Very specific question.
Yeah, I mean, in those 3 sessions, again, the data was so similar because a lot of hospital workers also identify as parenting and birthing people. And the same thing with doulas, right? Identifying in both spaces. So some people came to more than one. But what I will say is there is an activity that we do to evaluate trauma in care and perinatal care ecosystems. And it was designed by one of our Design for Equity experts. And it's one of the tools that actually came out of the space. And it was our grief and heartbreak despair exercise. And so what we ended up doing was we actually created a map that we took people on a journey during the equity and co-design spaces. And we asked people to name where the heartbreak or the despair or the grief happens in the perinatal system to them. And I would say for each constituent group or each role designated group, that the site of harm is actually very different for each. And when we say sites, we're not necessarily saying birthing centers versus hospitals versus this versus that, but we're actually talking about across the perinatal arc. So we discussed preconception, pregnancy, labor and delivery, the postnatal space, and so on, like across the reproductive continuum. And it was actually in those role designated spaces where the site or the moment or the peak heartbreak or despair in the perinatal arc, that's where things differed quite significantly, which I thought was interesting. Something that was similar across the groups was actually their future projecting or future casting maps. So while we had them draw and design maps that would say like where are the things happening across the actual perinatal ecosystem itself, where there's harm and where we're not seeing signs of vitality, those were very different for each of them. But when we looked at the maps for what the future should look like, a lot of these constituent groups had similar perspectives. Many of them were considering how land should be integrated in birthing spaces and wellness spaces. Of course, they saw the value of community and integration of family care and intergenerational care. There was also, I think, because of the target audiences, even within the role designated groups, a specificity around how culture was absolutely central, right? So those were some of the distinctions that I would say that we saw, and some of the similarities that we ultimately landed in. It was kind of surprising to see that like we all have a similar vision and hope for the future, though, which was inspiring.
Thank you for sharing, your methodology and what you found. I think, the heartbreak part really resonated with me because, I think we don't always ask people, where did the healthcare system fail you, right? We always ask, what can we do better, right? Not like, where did it fail you? And I think it's really important to actually just ask them, like, how have we harmed you? Like, what can we like learn from those situations? And yeah. Um, we had one more question. I see we're just on time, but I'm going to see if Savannah, you have an answer for this. Elizabeth in the chat said, with all the work you are both doing, do you talk about workforce development, utilizing peer-to-peer counseling, connection, and pathways for a livable wage?
We actually get at all of those. I think one of the components that maybe SisterWeb might be more tapped into is maybe the pathways to livable wage. I'm not sure, but we've been doing a lot of advocating with and for doulas around that go beyond Medicaid expansion and reimbursement. But I would say with the other ones, absolutely. Yes, certainly.
Yeah, I would say ditto. The peer-to-peer part, all of our doulas are from the community. 50% of our doulas are actually former clients. And so we have training, apprenticeship, and then a pathway to employment. We do provide full-time salaried benefited jobs for our doulas, and really trying to differentiate from that like side hustle, the gig economy where people are juggling multiple jobs. So yes, same, like Savannah said, I think the advocating for the Medicaid is a whole other topic. We could spend a whole other hour on that, but yes, we're involved in that.
So that brings us to our time. Please share all your kudos and thank you for our wonderful speakers today. Thank you so much for being here. Thank you to our speakers, Ali, Sophia, and Savannah, for sharing your insights, your knowledge, your wisdom. We really appreciate you sharing, about your work with our audience. We know that it's your time and that it means so much to us. Thank you.
Thank you so much.
There's some things coming in the chat for you all too. Okay, everybody, thanks for joining us. If you want to catch up on the webinar series, we'll email everybody who registered the link to where the recordings are going to be housed. So if there's anything else, you can feel free to email me or Cameron about anything related to, the Safer Childbirth Cities projects that AmChip is working on. Yeah, so it was great to host these webinars. Thank you so much for coming. Thanks to all those who came for all 3 days. Thanks for all who came today. Really appreciate you all. Have a great rest of your week.